some people are saying, utilize the medical students, those who,
like
utilize them
nursing
more.
students.
That's a good
Right,
idea.
yeah, that is a
And
good
so
idea.
that we also got a lot of those. Yeah.
Nice.
I wonder how you practice though. That's a good comment by Tomas, because med students, when they're practicing like to draw blood or something like that, they say you practice on a grapefruit, you practice on like a melon or something like
Maybe
that.
you practice on a straw.
Yeah, how do you actually practice to do like a swab and apply the right amount of pressure?
Practice on yourself.
Yeah.
Right.
None of us are in the healthcare field, but we have someone in the Zoom room who definitely is. So.
Yeah, we do. Let's go over to the Zoom room right now. We have hospital spokesperson Mai Habib. Good morning, May. Thanks for joining us.
Good morning, Chris, Sabrina, Jason, Tomas. Good morning, Guam.
Good morning.
Hey, May.
Let's
So-
just go ahead, Bree.
No, I was going to say, so today is the day, for elective surgeries?
Yeah, as of this morning, we're not doing any more elective surgeries. It was a really difficult decision for the hospital leadership to make, but as the press release said, we sort of really reached a critical point this weekend where our ICU was full, was at capacity at 14, and there were more people that were needing to be admitted to the ICU, and there was just no space. And there is an overflow for the ICU. It's called Care 2, and it's right across the hall from the ICU. It has 4 beds in it that are capable and equipped to deal with ICU level care. The unfortunate part is the staff, right? And that's kind of what it comes down to, is there could be beds, but if you don't have the right staff, you can't just put patients in beds and, hope that God takes care of them, There needs to be the proper staff for it. And that's where the difficult decision was, to keep one OR room open for emergency surgeries and then redirect the staff from the ORs for elective surgery to sort of Tetris through and make sure that we can open up that ICU overflow to deal with all the ICU patients that we're seeing.
And speaking of staff, how short is GMH in staff?
I think typically everybody's working pretty much full capacity anyways. And then when you have something like a pandemic, it's not just us. Every hospital, every medical facility across the nation is stretched. Sabrina, I will tell you that there's sort of a variety of things that are playing into this, So we already sort of were going into it with just enough to keep the hospital going in terms of nurses. And we had already had travel nurses, but many of the contracts were expiring and many of them did not renew. And it's really hard to bring back travel nurses right now. We're competing with extremely high rates in the States. Nurses are tired. A lot of the travel nurses who went through the first, second, and third waves on the mainland and even here on Guam, they're tired. Some of them took the wonderful amount of money that they made and they're just taking some time off. They're human too. So not only is it a lack of the actual travel nurse availability, but we're also competing with people who are paying, or states that are paying way more. And, Guam isn't that close. Guam is kind of a big decision to decide to come and move here, uproot your life here for 3 months, which, typically these contracts are 12 weeks. So we are having the conversations with the travel nurse companies to try to bring more. Additionally, what is also playing into our staffing situation is, we too are human and we too are members of this community. And so we're exposed to COVID. And some of our staff have either been needing to be off in isolation because they are in fact COVID positive, or in quarantine because they were exposed to somebody who was COVID positive, and we want to make absolutely sure that they're not positive before they come back to work. So these dynamics have been playing into it. I can tell you that the staff at GMH have been working their shifts and many more shifts and many overtimes and staying well beyond their hours just to make things work and to be able to care for everyone in the community.
May, we had a question here. If we could just go back to the beginning. Can you ask May to explain to the people of Guam some examples of what elective surgeries are?
I was really worried this question was going to come, actually. And I did not ask, and I'm not a medical professional, I'm a communications professional, but I can tell you that it's anything that's not an emergency. So if you are able to live with whatever the condition is, I assure you, you will continue to live with it until we're able to reschedule. I can get you examples and text you afterwards so
Sure.
you can answer on air.
But let me just
I
ask
don't have
then.
specific ones right now.
I appreciate that, May. But let me just ask: so, is a hospital calling people who were scheduled for elective surgeries and saying, "Hey, your surgery was elective," or how's that going?
Yeah, I think people know that if they're having an elective surgery, and the truth is we had shut down elective surgeries all of last year, right? So that's the big difference between this wave and last year's wave is last year, or waves, I guess, over last year, we had shut down outpatient services and all of the elective surgeries. So really, the hospital was really, really focused on emergency cases and COVID, whereas we reopened the hospital this year, right? And we allowed elective surgeries to come back. And we allowed outpatient services to reignite and have that. So in August, we shut down outpatient services, hoping that would free up enough resources to continue to deal with the COVID influx that we're in right now. And we were hoping to continue elective surgeries to keep those going because there was a backlog of surgeries when we reopened. So we were, forward scheduling all those people. But unfortunately, like I said, we really hit a critical point of needing the staff to open up that ICU overflow. So elective surgeries are non-emergency surgeries, essentially. And that's kind of where we are. That's where the hospital is in terms of needing the staff.
You mentioned staff and quarantining when the staff's positive, close contacts. Have we had any new staff infections since the last time we spoke?
Yeah, so the last staff infection that I know of was about 4 days ago. Again, household contact. A lot of these cases are household contacts or community contacts. I can tell you that right now, GMH staff, we have 11 people as of yesterday, 11 people that are in isolation, which means they are in fact COVID positive, of course, and 8 people who are quarantining. So they're quarantining out of precaution until we're absolutely sure they're negative, and all from household exposure.
Are we still utilizing the Perlis Court townhomes for the medical staff from GMH?
Right now, if there's GMH staff who need isolation, who can't properly isolate in their own homes, they're going to the isolation facility, the Guam isolation facility.
Bayview.
That's right.
Okay.
Do you guys have any GMH staff that turned positive hospitalized?
Say that again.
Any GMH staff that are positive with COVID, have any of them been hospitalized or are hospitalized?
None that I know of are hospitalized, although some have received the infusion monoclonal antibodies to support their recovery, but none that I know of that are currently hospitalized.
What about vaccinated?
Are people vaccinated? Is the question, are they vaccinated?
No, the healthcare GMH staff that are positive with COVID, are they all vaccinated?
They are mostly vaccinated. Yeah, they are for the most part, but it might be like a few, like very few that would be unvaccinated, but most of them are vaccinated. And that's a huge message actually, Sabrina and Chris, that we really want to get across is vaccinations are important, as we're seeing and the data is showing us. Vaccinations are important because there may be breakthrough cases and you may still catch COVID if you're vaccinated, but the truth is the severity and the acuity of your sickness is far less when you're vaccinated than when you're not vaccinated. I can tell you that of the 9 COVID patients in our ICU right now, 7 of them are ventilated, and of those 7, 6 are unvaccinated. So we are seeing, I know that a lot of people are saying, well, I got vaccinated. Well, I did this. Well, I'm doing everything. And I'm, if I'm still going to get sick, then what's the point? And the fatigue is real and we feel it more than anyone, like our staff is tired, our doctors are tired, our nurses, everybody is tired too. But the truth is what we're seeing is even when there are breakthrough cases, through the vaccines, the acuity and the severity of the sickness is far less. Yes, there are people who have comorbidities who are fully vaccinated, and there is one person who passed who was fully vaccinated, but he had a slew of comorbidities. But the truth is that right now, the vaccination is one of our best tools so that if, God forbid, you do get sick, you can just go home and recover, or if you have to be admitted, it's at a very minimal level of needing very minimal care and not, the severe ICU cases that we're seeing.
Well, like you said, the fatigue is real. I know I'm kind of tired of talking about COVID. I could just imagine what it's like over at GMH having to deal with this up close and personal. So I wanted to ask about the doctors at GMH. Have you guys lost any doctors that have just, resigned or quit? How many doctors does GMH have on staff?
So our numbers are still pretty much the same. I know of 2 doctors who have recently, I believe both of them did not renew their contracts. It's not necessarily because of COVID. People have different life circumstances. People have family on the mainland. They may have come out here for a short amount of time. I know I believe 2 of them have resigned and they're coming up to leaving the hospital. And 1 left in the summer, in August, I believe. We are constantly recruiting and we're constantly working with various companies to try to get the right amount of staff that we need and to continue recruiting doctors to the island. But again, and we say this often, and this is what we talked about really during Bill 112 a lot as well, is it's not easy to recruit here, We're doing our best. We have a wonderful atmosphere at GMH, which we offer. Guam is beautiful, beaches are beautiful. There's lots to do. There are so many pros to coming and working here. But the truth is our salaries are not matched through what they can get in the mainland, and Guam is really far. So people who do have family on the mainland, it's not as easy as say Hawaii or moving to California or moving on the West Coast somewhere. So we are constantly trying to recruit. We're not necessarily short doctors, but with the pandemic right now, everybody is stretched. Every single employee at GMHA is stretched.
Yeah, 3 doctors within the past month. That's a pretty big hit to GMH. So where are you guys in terms of replacing these physicians and recruiting new ones?
Like I said, the conversations are continuing. I believe that 2 of them are being replaced with contracts that may be coming up this fall. I'd have to get the details from our medical staff office, but this is a constantly changing situation. Much like the nurses, Sabrina, so for example, the travel nurses, we will get eligible nurses and we'll offer the contracts and we'll be ready to bring them on, and then they'll cancel last minute. So these are free and able-bodied humans who can make their own decisions, and a contract's only a contract, and they're not, obliged. We can't force them to get on the plane and come here, and people have varying demands in their lives. Yeah. So that's a challenge. That's a further challenge that we've seen with travel nurses, is not only is there a short supply generally, and that we're competing with such high salaries on the mainland, but also when we do bring them in, some of them are canceling last minute. We've had, I believe in the past month, maybe 2 or 3 that were, scheduled to come in, and they canceled last minute for various reasons, and that's just their prerogative. So I can tell you that we are very, very actively and aggressively recruiting doctors and nurses.
Yeah, and having said that, you're actively recruiting doctors and nurses. Is there a safe level of staffing at GMH?
Absolutely. Yeah, we're not at a level of it not being safe. That's exactly the reason we decided to shut down elective surgeries, is there is that need, right? So we have the staff, they are in the ORs dealing with elective surgeries. We were hoping to continue with elective surgeries because we want to service the entire community, right? We want to make sure that everybody is being serviced at GMHA, but unfortunately it got to a point where we need that staff to be on hand to deal with ICU level care and telemetry level care. So that's where that reasoning is. So there's never an unsafe amount of staff. Like I said, staff are going above and beyond, working overtime, working beyond their shifts. They're tired, but they're working and making it work. So our plea with the community is to just stick to the basics. It's working. We know it's tough. We know everybody is tired, but we're asking you again to please consider getting vaccinated if you can get vaccinated. Like we said, breakthrough cases are possible, but your acuity and severity level will be far less. In addition, wear your masks, wash your hands, and watch your distance, because the less COVID spread there is, the less demand we're going to see on our hospital. People are walking into our ER constantly with flu-like symptoms who test positive. And if they need to be admitted, those are the beds, right? So we're holding people in ER because we don't have enough beds, because we don't have enough staff. So it's sort of this domino effect, and it all really starts in the community. And we're just thanking anybody and everybody who's getting vaccinated and doing their part to help us get through this.
Right, but if you're talking about COVID fatigue and doctors and nurses going that extra mile, and obviously, they are tired. So how can you ensure then that to the public that it's safe?
I mean, we're still having staff show up. There's never an occasion of not having enough staff. There's never an occasion of somebody not getting proper care. We always have the doctors and nurses and CNAs and techs that we need. And so that's never a question. It's never a question about safety. There's always the people that are there caring for the community, even if they're coming in on their days off. The issue that we're trying to get across is that we are having staff come in on their day off. We are mobilizing every single administrative nurse. So nurses that are really just there to deal with all the administration, all the back end stuff that people don't see of the nurses' lives, all of them are mobilized to the floor so that they can help with clinical. We also have a request in with the Department of Defense through FEMA for additional staff as well to help us get through this. And it's looking positive. We don't have all the finals, but it is looking positive. We had requested 15 nurses, and the HHS team was here last week. The Department of Health and Human Services was here, and they did a tour of GMH, and they saw our need firsthand, and they know. So, but Sabrina and Chris, the entire country is stretched. This is not something that's unique to Guam. So even in our conversations with FEMA and HHS and DOD, they're saying that everywhere is needing. All the states are needing. There was just Hurricane Ida, and they had to mobilize a lot of active duty there. There's the Afghanistan exit that had to have a lot of active duty there as well. Right, so in many ways, in many facets, the nation is stretched. So they're doing their best. I know that they said that they're going into their reserves and they're trying to find reserve nurses to send our way. Nothing is firmed up yet, but we are hoping that within the next 2 weeks, we'll be seeing that influx of DOD staff so that we can give our own nurses and doctors a break. But I assure you that anybody coming into GMH will have the best service, because we'll always have somebody there. Nobody's not showing up to work.
I mean, it sounds like you guys are, I mean, if you're moving admin nurses off and doing like paperwork and data entry or whatever, and, putting them on the floor, it sounds like it's safe right now, but man, there's a lot of moving around the furniture on the Titanic there. And you're right. If the community, if the surge keeps up like this, I mean, it's only a matter of time before you're stretched thin now. I mean, 10 more people in the hospital waiting on these travel nurses and HHS. I mean, it's pretty scary. But does anybody ever just, when you talk about these cancellations or the last minute thing, does anybody look at our situation and say, oh God, no, you guys are level 4 CDC. You're up near the top in the death rate, the test rate per 100,000. I mean, you're really up there. It's just really too hot. And I mean, if people are stretched thin, Guam is probably the last place they want to come to.
We don't often even hear from the nurses themselves or hear their actual reasons why. It's just the communication with the company that says that this nurse canceled. So we don't know why, but we do know, I mean, we're realistic, right? And we know that the competition is very high, that states are offering a lot of money, that Guam is far. And like you said, our level is really crucial. Where we are right now is an entire island. So that could very well be a factor in their decision making, but we haven't heard specifically.
Can I ask just real quick about the National Guard moving the refrigerated container unit over to store COVID-related fatalities?
Sure, go ahead, ask.
Yeah, that was it.
Oh, that was the question.
Yeah, that was
it. Please discuss me. Go ahead.
Okay.
Yeah, so we don't have an exact day and time as to when it would come. It's looking positive that we are, in fact, getting that 40-foot reefer. It's an additional refrigeration. It holds up to 23 bodies. I can tell you that our morgue right now, and the CME morgue is full. And funeral homes do come and pick up bodies, but the rate at which we're refilling is quite high. So the GMHA and this CME morgue is full, and that's why we need that additional space.
I just wanted to follow up because you kind of touched on it with regard to FEMA. So we did reach out to Frank Mansell, the public affairs specialist out of Region 9, and he did provide an update to us that the request was sent in on the 13th and for the registered nurses. And he said within 14 days they should be arriving, so that would be the 27th. Is that still firmed up? Is that the target date we're looking at for the arrival?
The 27th is not a number that was floated. I think that week generally is a possibility. So sometime next week or late next week or the early following week. Like I said, they too are very stretched, right? So they're going into the reserves and trying to find nurses that fit what we need so they can send them our way. But it is looking positive. We just don't have things firmed up right now.
Okay. We're not going to need any more tents, are we? Up at GMH.
Any more tents? Right now we're holding at our one Blue Med tent, and hopefully it stays that way, and hopefully we continue going downwards with the positivity rate or the acuity rate, really, of people needing to be hospitalized.
Have there been any COVID-related fatalities since the ones that were reported in the JIC release last night?
None that we've seen at GMH. None that came overnight for us, so none from GMH.
Okay.
All right.
Did we do the COVID census? I'm sorry. I'm a little foggy this morning.
I don't think we did.
Can we just run through the numbers, May, before we let you go?
Sure thing. So right now, our total hospital as of 5 a.m. this morning, total we're at 179 patients. We do currently have 39 COVID patients. So we actually had 10 discharged between yesterday and today, but we did admit 4 more. So we're at 39. Of those, 9 are in the ICU. And of the 9 in the ICU, 7 are on vents. And like I said, 6 are unvaccinated of the vented.
Any children?
No, let me double check, but I don't believe we have any peds right now.
Okay.
Let me just double check. No peds ICU. Or sorry, no peds COVID.
Okay. Thanks.
Do you have the breakdown of the vaxxed and the unvaxxed?
I do. I counted them. However, it's based on 42 admitted. So we have released, because, as we release people, we have to update those. But
right.
It was based on 42 from last night. So the latest I have is of the 42, and this will be updated this morning, and I can share the updated numbers with you afterwards. But of the 42 last night when we did the report, 26 were unvaccinated, 4 were partially vaccinated, and then 12 were fully vaccinated.
May, last year during the first surge, we heard from like Dr. Jolie Nuggan and Lillian that patients who went on the ventilator, COVID positive patients who went on the ventilator, I want to say there were only a handful who made it off the ventilator. So when we talk about these ICU patients who are on the ventilator, do we have enough? I mean, have we had enough cycle through the ICU to kind of track whether or not they're coming off the ventilator successfully?
So far we've really had, to be honest, this wave has mostly been DOAs, so dead on arrivals. We did have, unfortunately, we lost one person at GMH who I believe was, but he had a slew of comorbidities, and it was a really it was a very fragile health situation. I don't have enough evidence, nor am I medically qualified enough to be able to say, what the survival rate is for people who get vented. I can tell you that our ICU staff is working nonstop to try to stabilize people and try to lower them down to a more stable level of care. So that's where we are right now.
May, we were hopefully, I don't know if you can track this down if you have the ability to, but we're trying to find out with the hospitalizations of the vaccinated, which vaccine they took and when they took it. Is that kind of data accessible to you, or is that more of a public health thing? Because public health says it too, guys.
Yeah, I do believe we have that data. I know from skimming the report that it's a mix of the vaccines and it's a mix of times of when they took it. Some people have been, especially the older people, the Manamku, who could avail of the vaccine way early on. You'd remember in December and January, many of them are vaccinated at that point. Some people are vaccinated April, May, June, July. So it's really all over the place. I could try to do a better number gathering for you, but it's a mix of the vaccines. There's not one over the other that we're seeing specifically.
I'd love to get that if you have it.
Sure.
Okay. Great. Good.
Oh, thanks.
Thank you so much, May. Appreciate having you on.
Thanks so much. Bye, guys.
Bye.
And
See ya.
get vaccinated.
There you go, Mai Habib, Guam Memorial Hospital. I mean, it's good to have her on, but anytime we're getting the hospital on this frequently, it's not a good situation, right? So it's good, it's not good. Okay. Let's take a break, shall we? And then we're going to go behind bars.